Right. Let's have an honest conversation. If you're watching this because you've noticed changes in your performance or you're concerned about your future health, then I'm genuinely glad you're here. Because what I'm about to share with you could quite literally save your life, not just your sex life, but your actual life. I'm Dr. Sophie Caldwell, and I've been a consultant urologist for over 3 decades now. I trained at King's College London, completed my fellowship at St Bartholomew's Hospital, and for the past 30-odd years, I've specialised in men's health and sexual medicine. I've worked with thousands of men, from their 20s right through to their 90s, dealing with everything from erectile dysfunction to prostate cancer. I've seen it all, heard it all, and treated it all. More importantly, I've seen what works and what doesn't. Now, I'm not here to frighten you or sell you some miracle cure. I'm here because after 3 decades in this field, I've noticed patterns. There are 10 things that men do, often without realizing it, that slowly destroy their erectile function, damage their sensitivity, and put their overall health at serious risk. Some of these you might be doing every single day. Others might seem harmless or even helpful. But I can tell you from decades of clinical experience, they're not. Here's something most men don't realize, and it's perhaps the most important thing you'll hear today. Your penis is basically an early warning system for your cardiovascular health. Think of it like the warning light on your car dashboard. When that light comes on, you don't ignore it, do you? You take the car to the garage. Your erections work the same way. When things start going wrong with your blood flow, your hormones, or your heart, your erections are often the very first place you'll notice it. This isn't just bad luck or a normal part of aging. It's your body sending you a very clear signal that something needs attention. The research on this is absolutely clear, and I've referenced studies from the British Heart Foundation and published work in the European Journal of Urology. Men with erectile dysfunction are significantly more likely to experience a heart attack or stroke within 5 to 7 years. Why? Because the arteries in your penis are tiny, much smaller than the coronary arteries around your heart. So they show blockage problems years before your heart does. This is why I always tell my patients at my surgery in London, if you're having erectile difficulties, we're not just treating your sex life, we're potentially preventing a heart attack. Let me share something from my clinical practice. Last year, a gentleman came to see me, 58 years old, frustrated because he couldn't maintain an erection. He thought it was just aging. We ran some tests, and it turned out his cholesterol was through the roof, his blood pressure was high, and his GP hadn't picked up on early signs of cardiovascular disease. That erectile dysfunction quite possibly saved his life because it brought him in to see me before he had a major cardiac event. So please, if you notice changes, don't brush them off. Pay attention to what your body's telling you. And if your doctor makes you feel embarrassed or judged, find a better one. You deserve proper medical care without shame. Right, let's get into the 10 things you should never do to your penis. I'm going to be direct, I'm going to be detailed, and I'm going to explain not just what to avoid, but why it matters and what you should do instead. Number 1, don't ignore changes in your erections. I've already touched on this, but it bears repeating because it's that important. Your penis truly is the canary in the coal mine of your body. When your erections start to weaken, it often means your blood vessels are narrowing. This is called endothelial dysfunction, and it's one of the earliest signs of cardiovascular disease. Biologically speaking, those penile arteries are only about 1 to 2 millimeters in diameter. Compare that to the coronary arteries, which are 3 to 4 millimeters. So when plaque starts building up in your arteries, you'll notice it, affecting your erections long before you feel any chest pain. According to research published in the Journal of the American College of Cardiology, men with ED are at a 45% higher risk of cardiovascular disease. Emotionally, I know it's difficult. Many of the men I see have waited months or even years before coming to see me because they feel embarrassed or worried about what it might mean. But ignoring this problem means you're missing a crucial opportunity to protect not just your sex life, but potentially your life itself. Practically speaking, if you notice your erections aren't what they used to be, whether that's difficulty getting one, difficulty maintaining one, or they're just not as firm as they once were, make an appointment with your GP or a urologist. Get your cardiovascular health checked. Have your blood pressure, cholesterol, and blood sugar tested. This could be the most important decision you make. Number 2, don't try dangerous home remedies. Now, I've been practicing for over 30 years, and I genuinely thought I'd seen everything. But the internet age has brought a whole new level of dangerous experimentation. I've had men come to my surgery who've put apple cider vinegar on their penis, built homemade traction devices out of bottle caps and elastic bands, or tried extreme stretching techniques they found on some dodgy website. Let me be absolutely clear about this. These cause micro tears in the delicate tissue, nerve damage, scarring, and in some cases, permanent erectile dysfunction. I've treated men in A&E who had metal rings stuck on their penis and needed power tools to remove them. I've seen men who've caused such severe damage they've needed surgery. There's a particularly disturbing trend I've noticed over the past 5 years with so-called penis enlargement techniques. Men use pumps incorrectly, or they inject substances that aren't meant to go anywhere near genital tissue. The damage this causes can be catastrophic. If you're thinking about using any aid or device, please only use ones that are medically approved and designed for safe use. In the UK, anything marketed as a medical device should have a CE mark. If you're considering constriction rings, for example, make sure they're designed to be easily removed and don't stay on for more than 20 to 30 minutes. Better yet, speak to a healthcare professional first. Your GP can refer you to a specialist sexual health clinic where you can get proper advice. Number 3, don't neglect hygiene. This might sound basic, but poor genital hygiene is one of the most common issues I encounter, particularly in older men who might have mobility issues or who've simply got into bad habits over the years. If you're uncircumcised, proper hygiene means gently retracting the foreskin, washing underneath with warm water and a mild, unscented soap, rinsing thoroughly and patting dry. This needs to happen every time you bathe or shower. If you don't do this, smegma builds up. That's the whitish, cheese-like substance made up of dead skin cells and oils. Left unchecked, it creates the perfect environment for bacterial growth, leading to infections, inflammation, and a condition called balanitis. But here's the flip side, and this is equally important. Don't overclean. I've had patients who, in their eagerness to maintain hygiene, wash their penis multiple times a day with harsh soaps or antiseptic washes. This strips away the natural protective oils, causes irritation, and can actually make infection more likely. The research from the British Association of Urological Surgeons recommends simple, gentle cleaning once daily with mild soap and water. That's it. Nothing fancy, no special products needed. And if you notice any persistent redness, itching, unusual discharge, or an unpleasant smell despite good hygiene, see your doctor. These can be signs of infection or, in rare cases, something more serious like penile cancer, though that's uncommon. Number 4, don't ignore pain, bleeding, or lumps. This is absolutely critical, and I cannot stress this enough. Any unusual symptoms need medical attention. If you experience pain during sex, blood in your urine or semen, any kind of lump, bump, or unusual growth, or a sore or ulcer that doesn't heal within a couple of weeks, you need to get it checked out. I understand the reluctance. Many men feel embarrassed or worried about what the doctor might find. But early detection of problems, whether it's an infection, kidney stones, or in rare cases cancer, makes an enormous difference to treatment outcomes. Let me give you some context. Testicular cancer, whilst relatively rare, is the most common cancer in men aged 15 to 49. The 5-year survival rate, if caught early, is over 95%. But if left untreated, it can spread and become much more difficult to manage. Penile cancer is even rarer, but again, early detection is everything. From my experience, I'd say 99 times out of 100, when a man comes to see me worried about a lump or pain, it turns out to be something benign. But that one time in 100, it's something that needs treatment, and catching it early makes all the difference. Number 5, don't take unnecessary risks during sex. Confidence and safety need to go hand in hand, and this is something I discuss with my patients regularly, particularly those who've been prescribed medications like sildenafil. Penile fractures are real emergencies, and despite the name, there's no bone involved. What happens is the tunica albuginea, the tough fibrous tissue that covers the erectile chambers, tears when the erect penis is bent sharply. You'll hear a popping sound. There's immediate pain, rapid swelling, and bruising. We call it the aubergine deformity because of how it looks. I've treated several of these over the years, and they typically happen in specific positions where there's forceful bending. If this happens to you, get to A&E immediately. This is a surgical emergency. The sooner it's repaired, the better the outcome for future erectile function. The other aspect of sexual safety that doesn't get discussed enough is lubrication. As men age, and particularly if your partner is postmenopausal, natural lubrication can decrease. This isn't a reflection on attraction or arousal, it's biology. Estrogen levels drop after menopause, and vaginal tissues become thinner and produce less natural moisture. The solution is simple: use lubricant. Water-based lubricants are generally best because they're safe with condoms and easy to clean up. This protects both you and your partner from friction-related injuries and makes sex more comfortable and enjoyable for everyone involved. Number 6, don't overheat your testicles. Your testicles hang outside your body for a very specific reason. They need to maintain a temperature about 2 to 3 degrees lower than your core body temperature to produce sperm and testosterone efficiently. Long sessions in hot tubs, saunas, or steam rooms can temporarily reduce sperm production and potentially affect testosterone levels. Sitting for extended periods with a laptop directly on your lap can have the same effect because laptops generate quite a bit of heat. There's also ongoing research about mobile phones and electromagnetic radiation, though the evidence isn't conclusive yet. Still, why take the risk? Keep your phone in your jacket pocket or bag rather than your front trouser pocket. For men concerned about fertility or those experiencing symptoms of low testosterone, these small changes can make a difference. It's not going to turn everything around on its own, but as part of a broader approach to health, every bit helps. Number 7, don't grip too hard when you masturbate. This is something men rarely want to discuss, even in the privacy of my consulting room, but it's important. Death grip syndrome, as it's colloquially known, is a real phenomenon. When you consistently use excessive pressure during masturbation, you condition your nervous system to need that level of stimulation to reach orgasm. What happens then is that during partnered sex, normal levels of stimulation don't feel like enough. This can lead to difficulty maintaining an erection or reaching orgasm, which creates frustration and anxiety, which then makes the problem worse. It becomes a vicious cycle. The neurological mechanism is actually quite straightforward. You're desensitizing the nerve endings through overstimulation. The solution is to retrain your sensitivity by using less pressure, incorporating lubrication, and being mindful about the level of stimulation you're using. This isn't about judgment. Masturbation is a normal, healthy part of sexuality. But like anything else, the way you do it matters. If you've noticed that you're having difficulty during partnered sex, but not during solo activity, this might be worth considering. Number 8, don't smoke. If there's one single thing guaranteed to destroy erectile function, it's smoking. I cannot overstate this enough. Nicotine and the other chemicals in cigarettes damage the endothelium, the delicate inner lining of your blood vessels. This reduces production of nitric oxide, which is the chemical messenger that tells your penile arteries to relax and allow blood to flow in. The research is crystal clear. Smokers are nearly twice as likely to develop erectile dysfunction compared to non-smokers. According to the NHS, stopping smoking is one of the most effective things you can do to improve erectile function. I've seen men in my practice whose erections improved noticeably within weeks of quitting. Beyond erectile function, smoking massively increases your risk of bladder cancer, one of the more aggressive cancers we deal with in urology. It's also linked to kidney cancer, penile cancer, and of course all the cardiovascular and respiratory problems you've heard about. I know quitting is difficult. I've never smoked myself, but I've worked with enough patients to understand how challenging it is. But there's so much support available now. Your GP can prescribe nicotine replacement therapy or medications like varenicline. There are NHS stop smoking services throughout the country. Use them. Your future self and your penis will thank you. Number 9, don't beat yourself up mentally. This is perhaps the most overlooked aspect of sexual health. Men often tie their self-worth to their sexual performance, and whilst that's understandable, given societal expectations, it's also incredibly damaging. Here's a truth that every man needs to hear. Every single man has off days. Stress at work, tiredness, relationship worries, financial concerns, health anxiety, any of these can affect your ability to get or maintain an erection. This is normal. It doesn't mean you're broken, it doesn't mean you're less of a man, and it doesn't mean there's something fundamentally wrong with you. What happens, though, is that one episode of erectile difficulty creates anxiety. The next time you're in a sexual situation, you're worried it'll happen again. That anxiety activates your sympathetic nervous system, your fight or flight response, which is the exact opposite of what you need for an erection. Erections require you to be relaxed, in a parasympathetic state. So, the anxiety creates a self-fulfilling prophecy. I've treated countless men over the years who've fallen into this pattern. The solution usually involves a combination of things. Talking to your partner about it openly and honestly, reducing pressure around sex, focusing on intimacy rather than performance, and sometimes short-term use of medication to break the anxiety cycle and restore confidence. The key message is this: your worth as a person, as a partner, as a man, is so much bigger than your erectile function. Don't carry this burden alone. Talk to your partner, talk to your doctor, but please don't spiral into shame and self-criticism. Number 10, don't stop using it. There's genuine truth to the phrase use it or lose it when it comes to erectile function. Erections serve an important physiological function beyond sex. They deliver oxygen-rich blood to the penile tissue, which keeps it healthy, elastic, and sensitive. During sleep, most men have between 3 and 5 erections per night. This nocturnal erectile activity is your body's way of maintaining the tissue. If these stop entirely, perhaps due to low testosterone, vascular disease, or certain medications, the tissue can become less elastic. Scar tissue can form, sensitivity decreases, and there can even be a slight reduction in size over time. This is why I often recommend that men stay sexually active, whether with a partner or through masturbation, even as they age. It's not just about pleasure, although that's certainly important. It's about tissue health and maintaining function. For men who've had prostate surgery or radiotherapy, we sometimes prescribe medications specifically to promote regular erections and prevent tissue changes whilst everything heals. It's called penile rehabilitation, and it's an established part of post-treatment care. So what should you do? How do you protect your erectile health and your overall health moving forward? First, take care of your cardiovascular system. What's good for your heart is good for your penis. That means regular exercise. You don't need to run marathons. 30 minutes of moderate activity most days of the week, whether that's brisk walking, cycling, swimming, or working in the garden. This improves blood flow, helps manage weight, reduces stress, and supports healthy testosterone levels. Second, eat a balanced diet. The Mediterranean diet, rich in fruits, vegetables, whole grains, fish, and olive oil, has been shown in multiple studies to support cardiovascular and erectile health. Limit processed foods, excessive red meat, and sugar. Third, manage your stress. Chronic stress elevates cortisol, which suppresses testosterone and constricts blood vessels. Find what works for you, whether that's meditation, exercise, hobbies, or talking to someone. Your mental health and sexual health are deeply connected. Fourth, get enough quality sleep. Poor sleep disrupts hormone production, including testosterone. Most adults need 7 to 9 hours per night. If you're snoring heavily, or your partner says you stop breathing in your sleep, get checked for sleep apnea, which is strongly linked to erectile dysfunction and cardiovascular disease. Fifth, maintain a healthy relationship with alcohol. Moderate drinking, that's up to 14 units per week, spread across several days, according to NHS guidelines, is unlikely to cause problems. But excessive drinking damages nerves, disrupts hormones, and affects liver function. All of these can impair erectile function. Finally, stay engaged with your healthcare. Have regular checkups with your GP. After 50, discuss prostate health screening. Know your numbers for blood pressure, cholesterol, and blood sugar. If you're experiencing erectile difficulties, speak up. Your doctor has heard it all before and wants to help. Now, if you're looking for additional support, there are some supplements that may help with blood flow. L-citrulline, an amino acid found naturally in watermelon, is converted in your body to L-arginine, which then becomes nitric oxide. Some research suggests it can support healthy circulation. Always discuss supplements with your doctor first, particularly if you're taking other medications. I want to finish by saying this. Erectile problems are not the end of your masculinity. They're not something to be ashamed of. They're not a sign of personal failure. They're a medical issue, and like most medical issues, they can be addressed. I've spent over 30 years in this field, and I've seen men in their 50s, 60s, 70s, even their 80s and 90s restore not just their sexual function, but their confidence, their relationships, and their overall quality of life. Small changes done consistently make an enormous difference. Your body is sending you signals. Listen to them. Respect them. Avoid the 10 mistakes I've outlined today, and you'll be protecting not just your performance in the bedroom, but your cardiovascular health, your dignity, and your future. If this information has been helpful to you, please do share it with someone else who might benefit. And if you've got questions or concerns, write them in the comments below. I try to read as many as I can, and your questions often help me understand what topics to cover in future videos. I'm Dr. Sophie Caldwell, and my mission is to help men feel informed, confident, and empowered at every stage of life. Remember, age is not the end of vitality. With proper care and attention to your health, you can enjoy freedom, confidence, and intimacy for many years to come. Take care of yourself, because you're absolutely worth it.